Welcome back. Today we are looking at antipsychotics as a method of modifying schizophrenia. We'll dive into the two main types of antipsychotics, how they work to reduce dopamine activity, and their differences. What are antipsychotics? Antipsychotics are drugs designed to manage the symptoms of schizophrenia, particularly positive symptoms like hallucinations and delusions. Schizophrenia is linked to overactivity of dopamine in the brain, especially in the mesolimbic dopamine pathway, which plays a role in emotion and reward processing. Antipsychotics work by modulating dopamine transmission to bring this overactivity under control. There are two main types of antipsychotics. 1. Typical antipsychotics, also known as first generation, and 2. Atypical antipsychotics, which are second generation. Typical antipsychotics were the first drugs developed to treat schizophrenia, starting in the 1950s. They work primarily by targeting dopamine D2 receptors. Typical antipsychotics have a high affinity for D2 receptors, meaning they bind strongly to these receptors in the brain. By blocking D2 receptors, these drugs reduce the amount of dopamine activity in key brain areas, like the mesolimbic pathway. This reduction in dopamine activity helps to reduce positive symptoms like hallucinations and delusions. However, because of their strong binding, they can also block dopamine in other pathways, leading to side effects. A well-known example is chlorpromazine. While effective at reducing positive symptoms, chlorpromazine can cause 1. Extrapyramidal side effects such as tremors and rigidity, because it blocks dopamine in the motor pathways of the brain, and 2. Tardive dyskinesia, a long-term side effect causing involuntary facial movements. Atypical antipsychotics were developed after the 1970s as an improvement on typical antipsychotics. They work differently. Atypical antipsychotics have a weaker affinity for dopamine D2 receptors. This means they bind less tightly, reducing dopamine activity without completely blocking it. In addition to dopamine, atypical antipsychotics also block serotonin, 5-HT2A receptors, which contributes to their effectiveness. This dual action makes atypical antipsychotics better at treating both positive symptoms, like hallucinations, and negative symptoms, like lack of motivation or social withdrawal. A well-known example is clozapine. Clozapine's weaker binding to D2 receptors leads to fewer motor side effects compared to typical antipsychotics. Its action on serotonin receptors may improve mood and reduce negative symptoms. However, clozapine requires regular blood tests because it can cause a rare but serious side effect called agranulocytosis, which is a drop in white blood cells. Here's a summary of the key differences between typical and atypical antipsychotics. Receptor target: strong D2 receptor blockade for typical antipsychotics versus weaker D2 blockade plus serotonin, 5-HT2A blockade for atypical antipsychotics. Symptoms. Treated. Typical antipsychotics treat positive symptoms only, whereas atypical antipsychotics treat both positive and some negative symptoms. Side effects. Typical antipsychotics have more motor side effects, such as EPS, while atypical antipsychotics have less severe side effects. Example drug: chlorpromazine for typical antipsychotics, clozapine for atypical antipsychotics. To summarize, typical antipsychotics like chlorpromazine work by strongly blocking D2 receptors, which reduces positive symptoms but can cause motor side effects. Atypical antipsychotics like clozapine have a weaker effect on D2 receptors and also target serotonin receptors, treating both positive and some negative symptoms with fewer motor side effects. Both types of antipsychotics are key tools for managing schizophrenia, but their mechanisms and side effects differ. Thanks for watching. If you found this video helpful, don't forget to like, share, and subscribe for more A-level psychology content.